Hello, everybody. So we are going to follow up with a couple of the questions from the chat that we didn't get to in today's presentation. So we'll go ahead and record answers to those so that you can all view them at your leisure. So go ahead if you want to read them off, Danielle. Or
sure, I'll read it. I'm looking at it actually. So I've got the we answered the one about the Spanish-speaking patients. So this question just has to do with time that it takes to do developmental screening. So saying that the ages and stages questionnaires take 10 minutes or more, challenging with a 20-minute visit. Which may be part of the reason that I don't use the ages and stages, because it did seem a lot more lengthy. Again, I think you have to you have to sort of pick and choose what's going to work for your workflow in the practice. And then also families being resistant to having questionnaires done ahead of time. Again, I think just for that very reason, I have the questions laid out in my template, and I just prefer to ask them myself. I find that probably takes less time. It's also less paper. I'm very resistant to using printed materials. We use printed materials for our MChat because it's just one sheet, but I think the ASQ is more lengthy. So again, I think you have to. I think it's really important to do this screening, and you've got to figure out a way to do it efficiently that goes with your workflow, and it might involve looking at various screening tools and sort of figuring out what's going to work best for yourself. I don't think there's one right way to do it necessarily, but I do think it's really important to incorporate it into your visit, and I think it's very doable to do it within a 20-minute visit span. It just may take a little bit of trial and error.
And as a quick follow-up to that question, in terms of having families fill some of this stuff out ahead of time, do you think is the resistance at the point of maybe you've mailed it to their home, or is it even sitting in the waiting room, like for example to do the MChat? Is there resistance there too, or is that okay?
No, I think if they're a captive audience in the waiting room or waiting in the, I mean, you're usually not going to go, they'll get roomed and you're not going to go in right away. So there's some time in the waiting room and there's some time in the exam room before you actually walk in. I think using something like the ages and stages in the waiting room or in the exam room is probably not realistic, because again, I think that's a longer questionnaire. But something that's fairly quick. I know I don't use the SWIC. One of our other clinics that I don't work in uses it, but they seem to manage to have people get it done. So that, that might be an option. Again, for me, just having the questions lined up for me in my electronic template, and I can just boom through them, basically, and ask the families and just check the boxes. So that's how I choose to do it. But so I agree with you. As far as like mailing something to the home, people just don't remember to do stuff. Life when you're raising kids, as you both know, is hectic. And so if there's another piece of paper that you have to fill out and remember to bring with you, it may not happen. So just depends on your population. I think my private practice that I had in Michigan when I was taking care of your kids, Matt, those folks might have been okay about doing it, but I think in a lot of clinics, it's just there's just not that much organization at home to remember to bring in a questionnaire. Let's see, the next one. Can you share any innovative solutions to delivery of services for early intervention in your state in the COVID era? That's a tough one. Are all evaluations and therapy are being done remotely? Yeah, I mean, this is obviously a new problem, that we're sort of stuck with, during this era, and I think we're stuck with it for now. And I have so many families now whose kids are trying to get speech therapy remotely. It's really hard to do speech therapy remotely, for a toddler or preschool age child. I honestly don't know. I think we're just going to have to be patient. I mean, this has been a lost year educationally for so many kids, that are doing virtual school. It's I think one of the biggest tragedies of the COVID epidemic is the impact that it's going to have long term on on just the educational impact that it's going to have on kids. So I'm hoping and praying that they're they're going to get the vaccine rollout done, and people are going to get vaccinated. The numbers are going to go down, but I think it's going to be probably at least a year, before things are quote back to normal. And we're just going to have to be patient. So I encourage families to do the virtual therapy, because that's what there is right now. And some of them are okay with it, and some of them are more resistant. They just feel like the kids don't really engage, but I don't really have another solution for that.
And do you, in terms of the COVID era, clearly the actual delivery of the services has been a challenge. I'm curious if you see any difference in uptake. Like, are parents more likely or less likely now than they have been in the past to, make that call to early intervention, or try to do whatever virtual? Has that changed at all?
I would say less likely. Yeah, I mean, yeah. So I've had a lot of instances where I've made the referral or suggested that they call First Steps here, and they'll try maybe 1 or 2 sessions, and then they just give up because they don't really feel like the kid's getting any benefit. And plus people are also stressed because they're also trying to work from home. They may have older kids that they're trying to help with with their virtual school which is mandated. So there's a lot of factors that I think is making it more difficult. So I just hope it's going to be over soon. But we got to be patient. Let's see. I find that with some of our APP colleagues, they do the screening but are less familiar with what doesn't pass or when to refer versus give activities to practice. Exactly. Less familiar with what doesn't pass or when to refer versus give activities to practice. I'm not sure exactly.
Is that maybe like passing or failing, like an MChat or a...
Yeah.
Like when to refer to services versus not?
Yeah, I mean, certainly, if you work with APPs, which I do, I think having some in-services or, making sure, because again, developmental screening is a really important part of what they do. I see it being a problem more maybe with physician's assistants than with nurse practitioners. I find nurse practitioners, if anything, are even more in depth, about making, going into, details about development. That may be a generalization, but I think if you work with APPs and you're concerned about their knowledge about development, have some in-services to have a few sessions, lunchtime sessions or Zoom sessions where where you're talking about screening and what milestones are expected at each visit and that sort of thing. I think that's something that you can address just with education within your practice to make sure that everybody's on the same page. Okay. I think that's all I got.
And I think that is all the questions.
Thank you. Excited for the next session. So that's good.
Thanks, Dr. Behar. I don't know, Matt, that innovative solutions to delivery of services for early intervention question. We are working on a project in Michigan here that Matt is also the director of. I wondered if you wanted to touch on that really quickly, Matt.
Yeah, I could mention that the project that Danielle's referring to is called the Michigan Innovations in Care Coordination, and the innovation there, I guess, is maybe less with the delivery. And that was actually part of my question to you, Dr. Behar, more about the coordination of getting families into services. And so this is a project we're piloting in just one county to use an electronic solution to connect all of the parts and pieces of that care coordination. So we've digitized the MChat and have it in a solution where you give the family a text message, they fill it out depending on their score and their preference. Of course, they can opt in or out of this, but it initiates a series of contacts to, for example, the county integrated healthcare networks and other service providers that are all part of the care coordination chain to help the clinics not have to bear the burden of all the follow-up calls and making sure that families are actually getting the resources they need to get into services. It's a really interesting project. It's fairly early on. We're only maybe a year and a half or so into it. If it's successful, it's something that we hope to be able to push out across Michigan and maybe broader. But yeah, it's a great project in line with that question.
Yeah, it's just, yeah, it really, I mean, follow-up is so key. I mean, so you can make a referral, but then you gotta follow up.
Yeah, exactly.
Carry out. So yeah.
And this is the system allows you to track that. So you as the pediatrician could know that the contact has been made and the referral into services has been made or even had or not.
Yeah. We're doing a similar project in our clinics with depression screening, because depression screening is mandated now for kids 12 and up, but then we actually have some folks that are working on exactly that problem, is making sure that they actually get referred, that the contact is made with an appropriate provider. So yeah, I think it sounds like a great project.
All right. Well, I think that is all of our questions. So thank you again, Dr. Behar, and thank you everybody for participating.